can see that we are observing social distancing. We have deliberately invited only a... Please don't come near again. Yes, distancing is not distancing if people are breaching it anyhow. So we have deliberately invited only a few members of the press because we do not want crowding that will breach the principle of what we are advocating, which is social distancing to keep apart from each other to reduce the risk of transmission. And it's a principle I would like all of you to also advocate and not only practice, but to also advise and advocate. And so I welcome you all to today's press briefing and start with an apology for having to postpone the briefing of yesterday. As of today, the 26th of March 2020, we have recorded a total of 51 confirmed cases of coronavirus disease in Nigeria, of which 32 are in Lagos, 10 in the Federal Capital Territory, 3 in Ogun State, and 1 each in Ekiti, Oyo, Edo, Bauchi, Osun, and Rivers. Of the 51 cases, 37 had immediate travel history to one or more of the coronavirus-affected countries in the preceding 2 weeks. 8 are confirmed close contacts of confirmed cases, and 6 have neither a recent travel history nor a known contact. While 2 persons have been cured and discharged from treatment, we have recorded just 1 fatality. All 48 presently active cases are clinically stable with only mild or moderate symptoms. The Nigeria Center for Disease Control has deployed rapid response teams to affected states to support response activities. I want to here already strongly urge all health facilities at all levels, whether public or private, to be on high alert for healthcare and also for healthcare workers of all cadres to maintain a high index of suspicion and to give full cooperation to contact tracers everywhere. The federal government, working through the Presidential Task Force on COVID-19, has issued a closure order on all land borders and international airports, effective since the 23rd of March 2020, except for approved essential and emergency flights. One major item in Nigeria's disease containment strategy is social distancing, which has been repeatedly announced. Directives have thus been issued at national and state levels to limit all large gatherings, including religious, social, and political gatherings, schools, events, and etc. Some states have put the maximum number of gatherings at 50, but a general order will be announced at some stage. Markets have also been closed in some states, and alternative solutions to the food supply chain have been created. More of the all-important social distancing measures shall be considered in the coming days. The inconveniences are regretted, but I urge all citizens to accept and practice them in good faith, as they are for our common good and in the highest interest of all of us. Public servants on grade level 12 and below with non-essential roles have been ordered to work from home, effective from March 24th. More measures may need to be instituted by the federal and state governments as the situation evolves. The other critical measure we are taking is contact tracing, which is ongoing at present, to identify persons who have been in close contact with confirmed cases. The Federal Ministry of Health is working closely with states and the Presidential Task Force on COVID-19 to review the response activities and to institute measures to protect the health and well-being of Nigerians. The Multi-Sectoral Emergency Operations Center, led by the NCDC, coordinates this and also other national response activities. The Federal Ministry of Health is working with Nigeria Customs Service and Nigeria Immigration Service and Nigeria Ports Authority to ensure surveillance at land and sea borders. Ships coming in through the seaports are also subjected to mandatory health screening of the crew and clearance by port health services, especially ships that sail from high-risk ports or those which have been at sea for less than 14 days, or any that has got a crew member who fell seriously ill. The NCDC communication campaign titled Take Responsibility has kicked off. It is a call to all residents in the country to join hands, to be proactive in taking greater individual and collective responsibility for the prevention and control of the spread of COVID-19 in Nigeria. You can join this collective effort via your social media platforms. I strongly urge individuals, businesses, professional bodies, media houses, and all committed Nigerians to take ownership of this campaign by developing and communicating prevention messages around the following critical thematic areas, which are frequent hand washing with soap under running water or using an alcohol-based hand sanitizer, coughing, sneezing into your tissue or disposing properly of the same, or sneezing into your sleeve if immediately a tissue is not available. Avoiding crowds, large gatherings, and needless physical contact. Cleaning all surfaces frequently with disinfectants. Getting information only from official sources. And self-isolating for 15 days on return from any international travel or on a close contact with a recently returned person. Call NCDC's toll-free number 080097000010 or the national emergency number 112, which we are working to link together to expand the system for improved speed and efficiency of phone service. Importantly, I again remind all citizens that this is not an assignment for government alone, but for all of us. I therefore urge you to play your part in your little way by taking social distancing seriously as a mark of your individual social responsibility and your contribution to preventing the spread of the disease in Nigeria. Ensure you maintain 2 meters of physical distance between you and anyone who is coughing or sneezing. These are difficult times in our nation and also in among many other nations, as you see if you look at television. The federal government is doing everything possible to contain the pandemic. The Presidential Task Force will continue to review our strategies and take steps as appropriate. Those who have had contact with affirmed cases or have returned recently from overseas should strictly observe this self-isolation and call in or register on the NCDC platform. Do not leave your house during the self-isolation period. If you are on supervised self-isolation, make sure your calling is regular as required, and as much as possible, stay in one room. Strictly limit contact with others for your family's sake. If during self-isolation you observe symptoms like cough, fever, shortness of breath, or general feeling of being unwell, avoid self-medication and contact NCDC on the number which I'll give again, 0800 97 000010 or the emergency line 112, which is easy to remember, 3 digits. For emphasis, I again urge you all to take care of your health and protect others by continuing to do the following. Regularly and thoroughly wash your hands with soap and water for at least 30 seconds, and if not possible, use an alcohol-based sanitizer. Maintain 2 meters distance between yourself and anyone who is coughing and sneezing repeatedly. And be sure you and people around you follow good respiratory hygiene, meaning cover your mouth and nose with a tissue or handkerchief if coughing or sneezing, and dispose of the used tissue immediately. Alternately, use your sleeve when you cough or sneeze when no tissue is available. Do everything not to mingle in crowds or to congregate unnecessarily, but stay away at home if you feel unwell with symptoms I have said, which are fever, cough, sneezing, or breathing difficulty. Again, avoid self-medication and use of chloroquine or derivatives until they are officially validated and approved by global and national authorities. Misuse of drugs can do a lot of harm, and Nigerian doctors are participating in the clinical trials of chloroquine and other derivatives. NCDC hotline is available around the clock, and it is toll-free, meaning that you do not pay anything for it. Various states also have hotlines that can be called for direct state-specific questions on COVID-19. We urge all citizens to use these lines for legitimate and serious means of reporting or requiring inquiries. Thank you for your attention. Donated some items to various African countries, and he delivered it to the headquarters of the African Union, which is in Ethiopia, Addis Ababa. And after he donated it there, he requested that from there it should be distributed to the ministries of health of every country. So the one meant for Nigeria is to come to the Ministry of Health in Abuja. And the same for every other country receiving their own, going to their Ministry of Health. And the minister is supposed to receive it personally and also take an inventory of what they say is inside. So one thing you must note here is that for the Ministry of Health. But the airline carrying this cargo is carrying cargo for various African countries, not only Nigerian owners inside. Moreover, they also had cargo that they intended to go and drop in Lagos. So they requested permission not to land 2 times. Instead, to go and land in Lagos, where they can deliver the Jakma cargo and also deliver other cargo that they had in Lagos, and from there proceed to other areas. Now, because I was in a very important meeting, Minister of State also and PAMSEC, we requested the CMD, Chief Medical Director of University of Lagos Teaching Hospital, to go and receive this cargo, and the Nigeria Air Force agreed to bring it to Abuja and deliver to the Ministry of Health, as is the practice for every country. So the Air Force brought it here, but even when it arrived at about 10 or 11, I was busy with some other things, so it was received personally by the Permanent Secretary. The inventory of what is inside has been given to me, and I've ordered that it should be distributed, which has been done. It's been carried out to all the various states, and Lagos is getting the lion's share. And we have written a letter to the Jakma Foundation, which I can read to you, to thank him for the message, which goes as follows. To Mr. Jakma Foundation, through their office, through the Minister of Health, Addis Ababa. Donation of response commodities for COVID-19. I write to acknowledge With thanks, receipt of Nigeria's consignment of the above-mentioned donation as conveyed in your letter communicated to us with reference number MTI XYZ and so on. The commodities received are 100,000 pieces of face mask, 20,000 pieces of test kits, 9,999 pieces of face shield, and 1,100 pieces of personal protective equipment. The government and people of Nigeria wish to express hearty appreciation to you and your foundation for this laudable gesture in identifying with Nigeria in our trying moment, while assuring you that the donated items will be effectively utilized in the containment or control of COVID-19 pandemic. Please accept the assurances of my esteemed regards. This letter was signed by me. If the consignment didn't come here, I would not be able to write that letter like that because I didn't receive it, but it has been received that way. The Lagos Commissioner of Health called me and asked if they could take their own, and I said, well, if I haven't received it as Minister of Health, you are not the minister, you can't receive it. I have to receive it first and write a letter of thanks, and then it shall be distributed. And he agreed with me. So it was done properly that way. I hope that satisfies your question. Okay, it's a matter of plain formality. All right. Now, you are talking about a top official who has tested. Top official who is, what was your question again?
The top official in the presidency who tested positive.
First of all,
where was he taken to, and how many contacts of him have been traced so far?
One aide of the president who was tested is in secure treatment somewhere. And I'll use that to answer your question, in that in responding to the treatment of COVID-19, we have 4 categories. And I think many of you are listening to us already know. I've heard this before. We have said that up to 80% may have little or no symptoms. Do you remember? I haven't heard that? Okay, so the first category is that some people will have no symptoms at all. Some will have mild symptoms. That's the second category. The third category is some will have moderate symptoms. And the fourth category is that some will have severe symptoms. They will require oxygen. They may even require a ventilator. Okay, so those ones with severe symptoms will go to Gwagwalada, University of Abuja Treating Hospital. The others will be in a facility where they can be taken care of. So an aide who tested positive is receiving treatment in a secure facility. Does not need category 4 treatment. He requires only a general medical treatment.
In Abuja or?
It doesn't matter where, but it's in a secure government facility. I can tell you it's inside Nigeria. Now, to come to the next question, with the question of food supply.
No, I said how many contacts of him?
Okay, well, the contact tracing has been very efficiently done, and I'll use the opportunity to also tell you that there are what you call close contacts, and there's also what you call casual contact, and there's what you call distant contact. Distant contact is a no contact. Like this gentleman, like you and me now, is like no contact. Okay? Okay. There's casual contact that maybe you shook hands. And then there's close contact when you sat together head to head and had a conversation or a long conversation or whatever. So you differentiate between those ones. So if you're looking at the casual contact and also the distant contact, if you call it that way, maybe we just see each other from a distance, those ones are not critical. So those contacts have been done and the tests have been carried out for all those who had any kind of these contacts. And the rule in the health sector is that I am not free to disclose to you anybody's who tested or what their result was, because it's personal. But those persons are free to disclose. I'm one of those who did a test, and my test is negative. The PAMSEC has allowed me to mention that his test is positive, is negative too. Sorry. The PAMSEC did a test, and I can assure you that his own test is also negative. Let me emphasize that. Okay. I've also been empowered by the Secretary to the Government of Federation to reveal his own test result, which is that it is negative. Any person who did a test will have to reveal by himself, but I cannot reveal. If you do a test now, I cannot sit down and tell the. Sorry?
Is that the number?
Yeah, well, I can't tell the number, but people who, it was efficiently done by NCDC. We didn't memorize the number of how many tests was done. So, as for the food supply, when you have to do a strict distancing policy, social distancing, it means having to interrupt certain activities that normally take place in society. And when you interrupt, you have to make provision for whatever consequences will come from there. And I also mentioned, for example, the changes in food supply chain to all communities. Every state of the Federation is now working out the modality of how they will do it, down to local government, down to community level, depending on how they believe it to affect them in that state. The way to affect Lagos is different from the way to affect Abia or Niger. So the governors will work out the effect, work with community leaders to see how to ameliorate whatever problems come up. All of us are also working with NEMA. As you know, NEMA is the government authority that is responsible for any mass emergency situation. Now, somebody is talking about COVID-19. We use a test kit that is sanctioned, approved, and in fact, to a large extent, supplied by the World Health Organization. So it's approved, and we insist on that. There are many, many, many vendors who are offering us test kit from here, from left, from right. We use WHO accredited test kit because the result you get has to be reliable, and it has to be dependable. It has to meet all the criteria for protecting our citizens. So there are people who are developing what they call rapid test kit. And the rapid test kit, they are testing other parameters. And those are the ones that are said not to be reliable, those ones. But we don't use that one here. We're not using those rapid test kits. So some of those rapid test kits are said to be unreliable, and they have not been verified by the World Health Organization. They have not been validated until they are valid. In fact, the manufacturers will tell you, when you use this rapid test kit, go and do the real test to confirm. So why do double test when one is not reliable? So you are referring to those kits which we are not using. As for the pharmacies and NAFDAC and consumer, let me assure you and remind you that if you are taking any medicine, it has to be on a prescription of a doctor. You've heard already of, in the newspapers, you must have read, of the reports that some people are suffering from chloroquine poisoning. Because you go and buy chloroquine, you don't know when to use it or how to use it or what the dosage is, you can suffer and punish yourself unnecessarily. So therefore, NAFDAC is doing its work, Consumer Protection Agency is doing its work, Pharmaceutical Council is doing their work, and anybody who has a problem consults a doctor and gets a prescription of what medicine to take and how long to take it and what dose to take to solve your problem. If you want to be your own doctor and you are not trained to be a doctor, you are going to be taking a serious risk. So do not go and buy anything and be swallowing unless the doctor has given you a prescription and also told you how to take it. Now, yes, somebody also spoke of governors. Yes, the same process in that if the symptom is mild or no symptom, some people test positive, but they really have no symptom at all. So they're in a secure government facility where they are being monitored and checked and also isolated in a secure facility. So if anybody gets to that critical level 4 type, we're going to move him to another higher level facility for treatment. But that situation has not arisen. Now, the other question was if we have learned any lessons. Yes, all countries are learning lessons. There is no country that will tell you that they were ready for this problem. If they were ready, you will not see any fatality. You will not see them getting nervous and changing their tactics every time. Many countries are changing their tactics. They do this today. After a week, they discover that it's not working. They change to another method. So because no country is ready and no country has the answer, and every country is learning. We too, we are learning. We are learning a lot, and we are also lucky. During that outbreak of Ebola in 2014, we learned a lot. And the knowledge from that period is serving us very well now. Serving us very well in our response mechanism. Our response agencies are doing very well. And I praise the NCDC and also the Lagos State government, the Commissioner of Health. And we have been talking to all the other commissioners of health. And we are going to arrange a virtual platform conversation very soon to update each other, particularly those ones that have just got new cases, single cases. And all those ones who they got definitely are seeded from Lagos, people who left Lagos to go to those areas, or who left Abuja, where you have the international airports, who left to go to those areas. That's what we believe, obviously, is responsible for those ones. Those are the questions. Any other questions?
Okay,
yes, we have learned many lessons.
Yes, but what of trying to put in place a more stronger health infrastructure?
Of course, we are doing that very clearly. We have a framework to build more intensive care stations, intensive care clinics and centers. We are learning to work together, all the various agencies, learning to know how to respond to mass problems, and also learning a treatment protocol. And we have requested also that the Chinese ambassador will send us some information about how they have handled their own situations and their own problems in their country. He was here some days ago to make some donations to us from his country, and to also appreciate Nigeria for sending them solidarity message during their time of trial. Or rather, to those who have absolutely no symptoms, those who have mild symptoms, those who have mild symptoms, those who have moderate symptoms, and those who have severe symptoms. Okay? And those who have severe symptoms are taken to a hospital facility where they may require more urgent treatment, including oxygen or ventilation. And that those who have mild or no symptoms can be treated in a different facility, which doesn't require that much of sophistication. So, and I also said that you are talking about the aid that is in a secure, I didn't say undisclosed, there's a secure situation where it's receiving attention. That's what I said. It also comes to your question, why is it being put here? There's no reason. The reason is that the symptoms and the level they are in is such that it can be treated in a facility that is able to handle that level of symptoms that is displaying. And if any other person here had that kind of symptom, he will definitely be classed like that. Now, to come back to your question about market women, it doesn't seem you understand what we are saying, because one person who has a problem like that, whether you are a market woman, whether you are a football star or you are a film star, is of importance to everybody. It has to be treated not only for that person's sake, but for the sake of the entire community. So even if you are a market woman, you will still receive the same attention, because otherwise, will somebody not go and buy from a market woman? Won't somebody go and buy from her? Okay. So it doesn't make sense that you think that a market woman will be ignored. It doesn't make sense, because a big man or big woman will go and bargain and buy. So we don't look at it that way, and your question is not properly placed. So yes, you're asking about if only 2 have been discharged. Yes, because we are grading our cases in such ways. That's why you haven't seen Gwagwalada overcrowded yet. Okay, we are grading them, those who are going to secure facilities, those who are going to less sophisticated areas. So we do have capacity to handle cases right now. The commodities, you're talking about face masks and so on, the ones we have received are going to be given to the states. And probably they will give to their hospitals, or the state commissioners will take control of those ones. Now, the mask is not for everybody who, if you don't have a problem, you don't need to be carrying it. But if you have a problem, you can wear them. If, for example, you are going into a hazardous area, as a doctor, for example, if I'm going into a place where a person who is being treated, I will wear one, I will wear PPE. So it's not every person who really has to. It's not that everybody in the whole country. Otherwise, Jack Ma will have to bring 200 million masks, and that is not practicable. So the stay at home, he said, military said in no distant time. I don't know where you heard that from. I don't think from a government source. I don't know where you get that information. Sorry? No, somebody said that there's a stay at home order, and the military is going to. I don't know what's that question. Aha, you are still the same one. You are. So those ones, I don't know where you got your news from, because they all seem to be a little bit upside down. So common person will be tested, everybody, because the interest of the whole society is that no person, not one person, should get out. That's why we do contact tracing. Contact tracing is not according to anything, but according to the fact that you are in contact. That's all. So don't start bringing categories into it where there is no category at all. So, and then the stay at home, I think that's already answered. Now, the second question is the mode of transition. Well, if a person is positive and close contact at great risk, and I believe that you're asking if it can be transmitted sexually, I do believe it can be, although I haven't seen any official publication. But I do believe that amounts to close contact also, and therefore high risk of transmission. Now, quarantine centers at doctors not be paid. I haven't heard of it. I don't know where you heard that. I haven't received any letter. I haven't received any communication. As far as I'm concerned, everybody is receiving their salary. All doctors are receiving their salary. All nurses are receiving their salary. And we have also issued an advisory to all doctors that time of a national emergency is not a time to start going on strike or demanding things that you think that's when government will respond. That's not ethical. We don't do that. And it's not a time to start trying to make extra ordinary demands. But I have not heard of anybody who has not been paid. The payroll is running and everybody is getting their salary. Now, masks, the site for isolation, they said is working or not working. That was your question. That people are not complying. Well, that's why we keep repeating it. That's why we have this briefing, and that's why I've urged you just now to join us in advocating self-isolation. It is for your own good. It's for the good of your own family and your friends and for your town that you do follow these rules and you isolate properly. We know that there are some people who will not isolate, and maybe a time will come when certain people like that will have to be dealt with as they are done in high-burden countries. But we don't need to get there. We don't need to get to their level. There are countries now where you can see police patrolling the street. There are countries where you have to tell them where you are going. Why are you on the street? We are not at that level. We are hoping that and believing that people will use their common sense and cooperate, and those who don't will probably be inviting the use of more sterner measures to make them cooperate. So social distancing in the market, I think, is still sinking in gradually for people to realize what it means and what they need to do. And the various state governments, are now, including the FCT, are working on measures to deal with enforcing this recommendation in markets. The ventilators, that's news to me. I don't know where you got that information from. There are people who are taking us of rumors. I have advised that we should not take rumors you hear on social media for certain. What I'm telling you here is the correct picture. Okay? Even National Hospital here has over a dozen ventilators, and ventilators are only required in the most critical case. And I don't think we have used it more than once. and a patient which we lost the other time. But otherwise, it's not it's only for a very critical few. And in some countries where they have critical few, where they have huge numbers, they have thousands of numbers of people, then they're really in difficulty. We are lucky and hoping that we don't get to that way, and not only hoping, we are working that we don't get to that level. I think we have answered all the questions. What was yours?
Enforced isolation.
That's what I just answered now. You are not listening. You are busy. You are busy with your phone. Because you are busy with your phone. That's why. So that's why you missed the answer. Yes. Go ahead. Yes.
My name is Francis from Channel TV. First, I would like to know the current state. When you briefed us on Monday, you said one of the patient is relying on oxygen. What is his current state now? Is he still on oxygen, or is Then the second one, part of what my colleague was making reference to, the NMA, they are calling for a total lockdown. In fact, they said they call on the president to invoke an executive order that way, make it mandate for all states to do a total lockdown for a period of time, maybe 1 month or 2 weeks. The reason they are saying this is because if we had done what we are doing now, if we had done it maybe 2 weeks ago, the latest cases that came in through the airport may not have entered. And so they are saying if the president can invoke an executive order and enforce a total lockdown, whether your state is recording any case or not, we'll be able to prevent this communal transmission, which we have not witnessed. Because if we allow communal transmission to take place, then we're in bigger trouble. So what is your take on that? Thank you.
Okay.
So I need this clarification. This issue of categorization of, this positive in terms of whether the person is mild.
Clinical symptoms.
Yes, clinical symptoms. So please, I don't know whether you reviewed our rules, because what you told us at the initial stage was that anyone that tests positive will be taken to isolation center, and I believe the reason was in order for us to.
They're still yes, but you're not getting it correct. They're still all in isolation centers, all of them. But the point is that
isolation centers, because for now I don't think
we do have this.
Any private isolation.
It's not private. I told you that it's in a secured isolation center. We have other isolation centers. Gwagwalada is not the only one we have. Okay? So we have other isolation centers, and I told you that depending on the level of severity, we have, because otherwise, Lagos has a larger isolation center. One isolation center will be quickly filled if you have cases there that are not mixing all the cases together. So we are grading them now. We have other isolation centers in Abuja. Let me answer his question first. Your question about the lockdown is not for this place, because that's go beyond the health sector. The Presidential Task Force will make a statement on that, on what the NMA has said. It's a recommendation, and looking at what other countries are doing. But I think that goes beyond this point. I think that was your own.
The patient who was on oxygen, is he still on oxygen?
He has improved. He has improved as far as we are told, yes. Yes. One more question and then we'll go. Yes.
Good afternoon, sir. I'm Rachel from News Agency. Honorable Minister, coronavirus is like the eye opener for some Nigerians, and some will argue that are we actually fighting the virus, or we are trying to improve in our health system? That's for Nigeria. Now, second, the picture from Italy and USA. I don't know if federal government actually picked something from it.
Picked something?
Yes.
Yes. If you read, I saw a report this morning that said one person writing his report, an American, that if the Americans had done what Nigeria did, they would not. It is opinion. So everybody is learning from the other. Because I've said repeatedly, this is a new virus. Number two, nobody knows behavior, and nobody was really ready for it. So everybody is looking at the other. Some have made mistakes, some are trying to correct mistakes, some are looking at. So there are some also looking at what we are doing. That with 200 million, we have just this number. And countries that don't have up to that population have high numbers. Okay? So they are also looking at what we are doing. But we are not gloating on that. We are not resting on ours at all, because we know the risk involved. We know that there's room to do better. There's room to do more. And so if you are going to compare from population to population or risk to risk, the figures from other countries are frightening. And even countries that have very strong health system look like they are overwhelmed. So if you don't, and I've always said that if you don't want to be overwhelmed, be quick, be fast at the beginning. Try to arrest it early so that you're not overwhelmed, because if it gets too big, it will overpower you, and it can get so big that it can overpower you no matter how strong you are. So that's the reason why every country is trying to learn from the other. You are correct. It's a good question. We are learning a lot from each other, and it's an eye-opener for many countries to realize that those who are very confident that they have strong systems have realized that they cannot withstand a very serious threat of this nature, and that they really have to prepare differently, prepare their health system differently. Because if you thought you are very strong, yes, nothing can happen. Ebola never came to your country. So, but you are saying now that something can actually also wound you seriously. So, we are also learning from them, from all countries, trying to find out where our weaknesses are to try and improve on them, and where our strength is to try and even make it better. And the ultimate purpose for every country to protect its own citizens. Again, I want to use this platform to appeal to everybody to follow the rules, wash your hands, and don't cough into the open, into people's faces, keep a distance, and also try to report cases of people who have arrived within the last 14 days from abroad, and they haven't registered. All those who have just come, go and register. You can even register online now that you just came, give your flight number, give your where you're coming from, and the date you arrived. You can do all of that so that we have more data for those who didn't register before and are able to follow up on every citizen. To be very thorough, because this thing came from outside. And if we are able to get all those who came with it and those who they have been in contact with, then we can reduce our risk, the risk to our citizens and to ourselves, and the impact on us. But as I've always said, our policy is to strive for the best scenario and then prepare for the worst scenario. So prepare for the worst scenario while striving for the best, trying to get the best result, but working hard to be ready for the worst case. So we are doing it both ways. Thank you very much, everybody.
Thank you very much for your time, and thank you, Honorable Minister, for your patience in answering all the questions. Yes. That brings us to the end of today's press conference. Thank you very much.
Yeah, what?
Our own kits. Face mask.
What? That's why I did not pass the sanitizer to everybody here.
Every time I come in, there was none.
We should have given everybody.